It's a pleasure for me to introduce Paula James from my congressional district, who is mainly here because she's the director of the Contra Costa Child Care Council Child Health and Nutrition Program. She serves on the board of the National Child and Adult Care Food Program Forum and chairs the California Child Care Food Program Roundtable, and serves on the California Department of Education Child Nutrition Advisory Council. Welcome to the committee, and we look forward to your testimony.
Thank you, Chairman Miller and members of the committee, for this opportunity to testify about the rapidly rising cost of food and its impact on the Child and Adult Care Food Program, and more importantly, the young children and families it serves. Rising food costs have more than ever increased the need for the Child Care Food Program, and at the same time have decreased access to the program and threatened to reduce the quality of meals served to young children. At a time when prevention of childhood obesity is of paramount concern nationally, we can afford neither. As families struggle to make ends meet, the Child Care Food Program becomes the more important to help fill the ever-widening gap between what foods families can afford to buy and what we know young children need to grow strong and healthy. More and more cash-strapped working families depend on the child care setting to fill some of that gap through meals served while their child is in care. As a family child care provider in Los Angeles stated, on Monday the kids are famished. They eat like they're starving. I don't know what they're eating on the weekends, but I have to plan big meals for Mondays. And a child care center director in Concord, California said, there is always the issue of hunger for our kids. They come to the center hungry and they will eat anything. The Child and Adult Care Food Program's good nutrition is important, not just because it provides enough food, but because it provides the right food, the healthy food. In a recent USA Today Gallup poll, 46% of those surveyed said that the higher cost of food is creating a financial hardship, primarily noticing an increase in the cost of milk, fruits, vegetables, meat, bread, and eggs. These are the same foods that comprise the meal pattern for the Child Care Food Program. A center director from San Diego stated, I will need to downgrade my great center menus because we can't afford all of the variety, especially of fresh fruits and vegetables. And a San Mateo Head Start program, which serves over 800 low-income children, said, last year our food cost increased 15%. Are we still able to feed our children nutritious meals? Yes, but it comes with a price of reducing the quality of our educational services. At the same time, need is increasing, access to the Child and Adult Care Food Program is declining, and nutrition quality is jeopardized. For some child care providers and centers, the balance has shifted. The cost of the gap between the reimbursement level and the cost of meeting the meal pattern and required paperwork is finally pushing them off the program. Participation in the family child care portion of the program has declined precipitously since tiering as part of welfare reform, and now we are seeing another significant decline, and for the first time, center participation has decreased. Only about 41% of children in licensed family child care are in a home providing Child and Adult Care Food Program meals and snacks. And I'm concerned about the nutritional value of meals available to the other 59%. A recent California study compared meals served by homes that participated in the Child and Adult Care Food Program to meals brought from home, and found that meals from home were of a significantly lower quality. Meals brought from home mostly contained juice and juice drinks, not milk. Chips and cookies were common, and there were very few vegetables and sources of lean protein. And we expect these results to be confirmed in a larger statewide survey funded by the Robert Wood Johnson Foundation. A family child care provider from Los Angeles had this to say, I shop at discount stores and try to stretch the money. I try to buy fresh fruits and vegetables, but the cost is going up. Everything we use, apples, broccoli, even the canned stuff is going up. Milk has doubled. We really need the food program. So many kids will suffer if we don't have it, and then learning will suffer. Yet I talk to providers every day who are leaving the program because they can't afford to buy the foods the program requires. A sponsoring organization in Alameda County noted that providers are cutting back on seconds. They're serving more crackers instead of vegetables at snack and less milk because it's too expensive. The quality of food choices has changed. Rising food and fuel costs have also threatened access by exacerbating long-standing pressures on an already fragile child care food program support system, the community-based organizations that sponsor the Child and Adult Care Food Program participation for family child care homes. California has seen half of the program sponsors drop out in the last 12 years. Nationally, 27% have dropped. In my own organization, the Contra Costa Child Care Council, our board of directors has authorized $100,000 of other agency funds to subsidize the cost of administering our child care food program. So what are some of the solutions for protecting access and quality of meals for our very young children in this time of increasing need? First, we would support the recommendation to insert a trigger requiring a mid-year adjustment for child nutrition programs if the CPI rises above a certain level. Secondly, the 2009 Child Nutrition Program reauthorization will be an important opportunity to improve the program, and I've outlined many of those recommendations in my written testimony. I would, however, like to highlight two. The first is to increase, obviously, the Child and Adult Care Food Program reimbursement to reflect the increased cost of meeting the program requirements and hopefully the dietary guidelines. And the second would be to enhance sponsoring organizations' reimbursement rate for serving family child care homes in low-income areas to cover the additional cost of visits and time spent in helping providers overcome literacy and language issues. Again, I want to thank you for this opportunity to share what we know about the impact of rising costs on the Child and Adult Care Food Program. Clearly, it is in the best interest of millions of young children in child care to act to protect the Child and Adult Care Food Program access and quality in this time of increasing need. And I would like to close with a quote from a Child Care Center director in Congressman Miller's district who said, "We worked really hard to make really good changes to our menus to provide nutritious meals for our kids. We can't go back on them, and we won't, even if it means the money we had for instructional materials has to be spent on food." Thank you for this opportunity.